Good evening, everyone. It's David Porter, and tonight I want to talk about the master's level mental health care providers. In my previous video, I described the difference between a psychologist and a psychiatrist. Psychologists are the doctorate level mental health providers, and psychiatrists are physicians who specialize in the treatment of mental illness. There are a variety of other people who have master's degrees, generally referred to as master's level counselors, and there are 4 different types. The most common is a licensed clinical mental health counselor, and this title is going to vary somewhat from state to state, but the requirements are similar. A master's level counselor, licensed clinical mental health counselor, is going to have a bachelor's degree, typically in psychology, although biology would also be a very useful undergraduate degree to have for this. Criminology would as well. And then they have to earn a master's degree, which is going to be another 2 to 6 years of graduate level studies, level 500 and level 600 courses. And typically they're also going to have to do a master's thesis, which is a research paper, typically 30-40 pages, 30 to 50 sources, and they may have to defend their thesis. They may have to present their thesis in front of their peers or professors and answer questions about it and defend the positions that they've taken. The master's level or the graduate degree in psychology will also include a internship where you're going to work in a clinical setting and receive supervision from an experienced and licensed mental health provider. Once you've completed this, you may have to do anywhere between 2,000 and 6,000 hours of supervised practice, and this again varies from state to state. And supervised practice means that every week you are going to be meeting with a clinical supervisor, a licensed and experienced individual who will review your cases, because you're going to be doing pretty much all the same tasks that a licensed individual will do as you work towards your own licensure. You just do it under supervision. So you will see patients, you do diagnoses, evaluations, you do psychotherapy, you have to write progress notes and treatment plans and termination plans, and your supervisor will check your paperwork and review everything and either sign off on it as approved or return it to you for editing, or they may have questions about something you've written. You'll meet with your supervisor to ask questions, get direction, feedback, opinion, guidance, and also a very big part of this is self-awareness, examining your own emotions and reactions to your patients, being aware of how they can influence the therapeutic process. So 2,000 to 6,000 hours, anywhere from 1 to 3 years of full-time work weeks under supervision. And at that point, you're qualified to sit for the exam and be licensed for independent practice. So that's a licensed clinical mental health counselor. You also have, marriage and family counselors, MFTs, who are similarly trained and educated, but their focus is going to be on couples counseling and family counseling. You also have plenty of people who have both credentials. They're licensed clinical mental health counselors and marriage and family therapists. You have MSWs, Masters in Social Work. They have taken a different type of graduate degree, the Masters in Social Work, and it has a different theoretical orientation. They're qualified to do psychotherapy, but they tend to see things more from a systems perspective rather than individual perspective, and they may be more involved with doing case management, coordination of services, rather than only psychotherapy, and may work in an organization which reflects that, a state job doing case management rather than doing as much emphasis on doing psychotherapy like the clinical mental health counselors. And then the 4th type is the LADC, licensed alcohol drug counselor, and again, different state, different title, similar requirements, similar job description. I'm an LADC, and it took me a long time to earn this credential. 4 years, 4-year degree in psychology, graduate degree in psychology, 6,000 hours of supervised clinical practice, working almost exclusively with people with addictions to drugs and alcohol. And upon conclusion, I had to write a 40-page paper and present it and defend it in front of a group of experienced licensed professionals. And I had to take a total of 3 written exams in order to be licensed. Now, this was in the early 2000s, and since then the requirements have changed. They're not as rigorous as they were when I took it. You don't have to write the 40-page case report and present anymore. I think there are still 3 written tests, and you still need the 6,000 hours of supervised practice and the graduate degree. But they have loosened up some of the requirements a little bit, which I don't agree with, but more about that on another video. So the LADCs, while we primarily do counseling for chemical dependency, there are LADCs who also do behavioral counseling for behavioral addictions, such as gambling. And if you have taken a graduate degree in psychopathology, also known as abnormal psychology, you are qualified, at least in the state of Vermont, to do some general psychotherapy as well, related to addiction. What I do is anger management, PTSD, mostly in victims of violent crime and sexually based offenses. I see both victims and perpetrators of domestic violence, sex crimes, and child maltreatment. There's a tendency that all of those offenses are connected to substance abuse. Typically, the victim or the perpetrator will be under the influence of drugs or alcohol at the time of the offense. Substance use, intoxication on drugs or alcohol tends to be a pre, co, and post-offense behavior for the offender. And many people with PTSD will use drugs and alcohol to try to take away the psychological pain that they suffer with every day. That is actually part of the diagnostic criteria for PTSD, use of drugs or alcohol to try to modulate and attenuate psychological pain. So those are the 4 types of clinical or master's level counselors. Thank you for watching, and please hit subscribe, and feel free to leave a question or comment in the comments section, as well as requests for topics in psychology, forensic psychology, chemical dependence, motivation, personal growth and improvement, anything along those lines. Those are the type of things that I make videos about. So everyone, have a good night. Be safe.